Hi, this is Dr. Sandeep Mahapatra, consultant hair transplant surgeon at Neo Follicle Hair Transplant Clinic, Bangalore. Today I am going to discuss about female pattern hair loss and how we do hair transplant in females. Nowadays, a lot of queries are coming with regards to female hair transplant sessions. Female hair transplant is a very ambiguous topic. Today also I am operating for a female who has a diffuse thinning overall on the entire scalp. So who are the candidates who can opt for hair transplant in case of females? So I'll just brief you with the basics that we essentially do hair transplants in female pattern hair loss. Female pattern hair loss can be due to a lot of reasons, genetic or hormonal like hypothyroidism, PCOD induced or excess of androgen secretion, hyperandrogenism we call it. So it is divided by Ludwig's classification into three parts: type 1, type 2, type 3. From type 2 to type 3 onwards, even we do hair transplants where the medical management fails or we don't get that much results out of medical management. Primarily it means how to tackle the androgen response to a female patterned hair loss by giving oral or topical minoxidil, sometimes androgen blocking agents like finasteride, dutasteride, and even by giving peptide hair serums or doing certain procedures which primarily, as you know, we opt for PRP, platelet rich plasma, growth factor concentrate therapies, QR678, stem cell mesotherapy, etc. When these medical procedures don't give that much results and the baldness is too severe, progressing to grade 2-3 female pattern Ludwig's scale of hair loss, or we call it a simpler staging, grade 3 to 5 onwards, we plan for hair transplants in females as well. So primarily hair transplant in females is more over the same like what we operate for males, but in females we don't trim the entire scalp. We just take a zone of donor area trimming we do, and the long hairs on the donor area covers that area once we extract the hairs. Once we trim the zone, we give local anesthesia and start the procedure by advanced FEV technique known as Neo Follicle hair transplant methodology what I adopt. Then we start extracting the follicular units, which can be in a group of 2 hairs, 3 hairs, single hairs, 4 hairs. So first of all, we segregate those grafts, we preserve them in the PRP or GFC solution, and once the grafts are extracted, we start implanting one by one by the help of some European implanting devices to get that proper depth direction angle to the hairs, so that we can increase the density in case of female pattern hair loss, build a new hairline for them however they want it. I'll discuss about the hairline later. So female pattern hair thinning can also be tackled with hair transplant if we extract properly and meticulously implant in between the existing hairs without causing much damage to the recipient area, neither the donor area. So as we have discussed, this is just a hairline correction. I would like to point out a female hairline is primarily concavity downwards, not upwards like male. It is the reverse. So we create the widow's peak, we make it irregular, we place singular grafts in the front, and then we build up the density with follicular units of 2 hairs and 3 hairs, and we create the temples with the concavity downwards. So always it shapes downwards so that it gives good results in females. Or like this pattern where we create a widow's peak. If you see, we have created the frontotemporal widow's peak here to give a proper angle, and then we implant so that it looks very natural, and then taper it towards the the temporal area to give a good temporal volume and a good hairline. We can lower it down, giving them a natural hairline. This was regarding the hairline. Now coming to the hair transplant per se, where we can add up the density even to females. So density filling is a tricky area again, where diffuse thinning has already happened. So the progression of disease is already there. It is not always recommended to do hair transplant at the first instance. So we'll try the medical management for 6 months, 1 year, even 2 years, 3 years, depending on the patient's response to the medical therapy. After that, even if the progression is so much that it has progressed to an advanced stage of hair loss, then we opt for density filling so that we fill in between the gaps, and then we give them a good hairline, a good density overall. so as to we can create a natural hairline, and the diffuse hair thinning in females also can be prevented. I'm just showing there's a male pattern where 2 weeks growth happens and then 5-6 months the density improves. Similarly in female it starts happening. But females require a little more management in terms of post-operative care like medications, subsequent sessions of PRP, GHC or mesotherapy as advised by their doctor. So in female pattern hair thinning, a proper consultation and counseling and proper workup is required before proceeding for any hair transplant procedure. I am again telling you it's a tricky scenario, and I am just now going to implant hairs for today's female pattern hair loss because there is a very diffuse area of hair thinning and the donor area is also weak. So I have already aligned them what might be the expectations after 6 months, 8 months or 1 year after hair transplant. If they maintain the existing hairs well with proper supplements, nutrition, maintain their hormone levels well, take care of their lifestyle and continue with the medications which we advise, the hair transplants are moreover successful even in females. Thank you so much.